All right. Hi, everyone. Thanks for being here. And thanks to Dr. Mullighan and Dr. Stock for helping us better understand the field of immunotherapy. And thanks to the NoALL team for putting on this webinar today. As I said, my name is Jess Olson, and I am looking forward to sharing my experience as a leukemia patient with you today. A little bit about me. As I said, my name's Jess. I'm currently 37 years old, or years young, I should say. I was diagnosed at 35 with Philadelphia chromosome positive B cell ALL a little over 2 years ago on September 7th, 2023. Prior to diagnosis, I was an active young professional working as a podiatrist and foot and ankle surgeon in Southern California. I had actually just taken the professional step of opening my own practice in August of 23 and balanced my busy career with my love for being outdoors. My wife, Catherine, and I, we enjoy camping. There are 2 dogs and our cat. Yes, the cat does go camping. And we go hiking, do road trips. And we had actually just gone on a rigorous whitewater rafting trip in late July. And we were taking the exciting step of starting our family planning that summer. So all good things were coming our way that summer. And I felt good up until August, 1 month prior to my diagnosis. I was feeling really run down and had this really bad right collarbone pain and would sometimes radiate up to my TMJ. Initially chalked these vague symptoms up to active summers and a busy work schedule. But by the end of August, I was unable to even put my scrubs on to go see patients because of the excruciating pain in my collarbone just by moving my arm through the shirt. And I started to develop random bruising on my legs and worsening fatigue with cold-like symptoms. And then on the morning of September 7th, I woke up with this really odd, sharp electrical pain in my chest and made the decision then that it was probably good to go to the emergency room. There, I had an EKG done, blood work, and x-rays. And turns out my EKG was normal, but my blood panel showed that I had 22% blasts. Now, normal is less than 5%, and greater than 20% is generally diagnostic for leukemia. So given these smear results, I was then sent for a bone marrow biopsy, which then later confirmed that I had the Ph positive B ALL. Now, when the ER doctor came into the treatment room to tell me the news, I told her she had the wrong room because I was there for my collarbone pain. But it turns out I did end up having a fracture of my right collarbone due to the leukemia weakening my bone marrow. And then as for those cold-like symptoms, turns out I also had COVID due to a weakened immune system. So moral of the story, when something feels wrong, it probably is. Next slide, please. I was then transferred to City of Hope Medical Center out here in California, or Cancer Center out here in California, and met my care team and pretty much immediately started treatment. I was inpatient and sequestered to a negative pressure room for a month because I was still testing positive for COVID. During my induction phase, I received vincristine, dexamethasone, and panatinib, a tyrosine kinase inhibitor, or TKI, that was used to treat the Ph positive status of my diagnosis. And then as a result of being unable to leave my 10 by 10 room for a month, I was pretty deconditioned physically by the time I was discharged and had a difficult time walking. I was able to achieve remission at the end of induction, but I was still MRD positive. And then as for consolidation, I was started on blinatumomab, the immunotherapy or the BITE, and was inpatient for a few days to monitor for the severe side effects that Dr. Stock just talked about. And thankfully, I was able to tolerate the blinatumomab relatively well and was discharged home with my fashionable fanny pack that held the pump and allowed me to be home for most of my treatment, which I think cannot be understated enough in terms of patient care and what that change looks like with the advent of immunotherapy. So as I said at the end of induction, I was still MRD positive. However, after my first cycle of blinatumomab, I had a bone marrow biopsy and it showed that I was MRD negative after just 1 cycle of blinatumomab, which was a major treatment win. I completed a total of 5 cycles of blinatumomab, completed this immunotherapy treatment in May of 2024. Was still feeling relatively tired, but was much stronger physically at the end of this phase of treatment. Now, in addition to the chemotherapy, the immunotherapy, and my TKI, I received 15 lumbar punctures with IT chemo and an intermediate dose of methotrexate. And these were all done for CNS prophylaxis, so to prevent the leukemia from crossing the blood-brain barrier. I completed my final lumbar puncture just about 6 months ago. And as much as I love my IR doctors and friends in the field, so much so that I actually think I had my last LP on Valentine's Day. I'll be happy to never have another one again. And I often do wonder what a poll would show if we asked ALL patients if they preferred bone marrow biopsies versus LPs. I know I have my answer. And I am now in my maintenance phase and on panatinib, along with a few other prophylactic meds daily. Now, overall, my treatment protocol is relatively new and uses immunotherapy and TKIs as the cornerstones for treatment without the need for transplant. So for those that are interested in this newer research, or for anyone who just likes a little light reading before bed, I can refer you to those studies that were used to guide my treatment during the Q&A session if you want. Next slide, please. So what did all of this treatment actually feel like? Well, thankfully, the advances of immunotherapy have improved the patient experience, but there are still side effects, and they should not be overlooked by patients or providers. My primary side effects were body pain. I'd feel achy and sore and had pretty significant muscle spasms in my legs. These were more pronounced while I was receiving the blinatumomab via infusion. And I did ultimately find relief through what I affectionately call my legs, which, if you're familiar with Normatec compression boots or sequential compression therapy, basically you wear those and they can just help sort of massage your legs. And that, in conjunction with an occasional low-dose muscle relaxer, helped mitigate some of those side effects. In addition, fatigue and headaches, I would sleep for 12 to 14 hours a day, and then would sometimes still even need a nap. I guess rebuilding a healthy bone marrow does take some energy. Caffeine pills and cool compresses would help mitigate these side effects. One other side effect that I still am battling is the cancer-related brain fog. This side effect is especially frustrating because I am used to functioning at a high level as a doctor, but regularly forgetting words in everyday conversation has been kind of challenging to accept. And then lastly, infections. I was pretty susceptible to infections during treatment and still am in my post-treatment phase. Despite taking all the prophylactic measures against infection, I managed to get sick around every 6 weeks. But thankfully, most of the time I can be treated as an outpatient. So, overall, I think immunotherapy is still relatively new. So it's important for patients receiving the treatments to be open and honest about the side effects they experience, as they may not be as widely known to patients or even healthcare teams. And by doing so, this can lead to a broader understanding for everyone. Next slide, please. Now, patients are not the only ones who experience the good, bad, and ugly of ALL treatment. Our caregivers and support systems are often right beside us through it all. For me, I had a difficult time performing regular daily tasks like walking the dogs and cleaning the house due to side effects and deconditioned physicality. But these ultimately fell to my wife and family and friends. It was also a transition for me to reconcile my previous active and adventurous lifestyle to one more of rest and recovery. And in that same vein, transitioning my mindset from a provider to a patient. Some days I would want to know everything about ALL and read every article. And other days I had a hard time even accepting that this was my reality when I was walking into the OR as a patient for an LP instead of as a surgeon. And given these profound lifestyle shifts, I think it's crucial for caregivers to also practice self-care to avoid the burnout and cope with the complexity that is inherent with a cancer diagnosis. And then patients and caregivers alike can benefit from community support through various elements and phases of treatment. Next slide, please. So from a patient perspective, what does high quality patient care look and feel like? Well, from my experience and talking with other ALL patients, these are all important pillars, and I'll expand on these in the next slide. So next slide, please. Looking a little more in depth at these pillars through the lens of a patient and how healthcare providers can provide high quality patient care. I think clear and realistic education for patient and caregivers is vital. By providing that framework for treatment, remission, and survivorship expectations, this can help patients and families navigate the transitions from active treatment to remission to survivorship. It can help reduce some of that remission anxiety that can come along with those changes. Educating patients and caregivers on side effects and the impacts they can have, while also normalizing that side effects can linger despite clinical remission, can help validate the patient experience as a whole, because sometimes it can feel as though we are reduced to lab and biopsy results. And then access to resources. I think connecting patients to resources to reduce the burden on families is critical. And these can be done through ancillary care teams or social work teams. Continuity and access to care teams, continuity and access to the care team, I think is important as well. I found having open communication with my care team via email was helpful and crucial in building trust. In addition, the continuity of care between all of the care teams, my oncologist, the infusion center, the radiologist doing my LPs, inpatient teams, each had direct knowledge of the exact treatment protocol I was on and what stage of treatment I was in. And that allowed for full confidence in my care and reducing treatment anxiety. And then finally, I think high quality care is the sum of its parts. So, meaning that like healthcare providers and patients are both active contributors to treatment. Having access and knowing you can advocate for yourself and ask questions is an important mindset for patients to have, as is the ability for providers to foster a continued shared decision-making approach throughout all of the phases of treatment. And on that note, I just want to express my gratitude for my primary treatment team at City of Hope. I'm fortunate for their expertise and high quality of care that they continue to provide. And by doing so, have instilled trust and confidence in me as I do forge my path from patient to survivor.